if the Holy Spirit is showing me that He wants to heal a certain area, I am trusting Him that He can do it in the small window of time that I have with those patients.
Welcome to the Restore Healthcare Project. I am Dr. Jennifer Kang, and I'm thrilled to have you here with me today. I just want to remind you to like, follow, subscribe, and don't forget that 5-star review to help us get the word out. I am here today with Joey Park, who we met before, and we're so happy to have him back here with us. Joey Park is a physical therapist who is an extraordinary follower of Jesus and is here to talk to us today about one of his favorite topics, which is leading patients out of pain. Now that's a good hook, Joey. What does that mean? Welcome.
Thank you so much for having me again, Dr. Jen. It is so great to be here, and I am excited to talk about this topic of leading patients out of pain.
Yeah. Tell me a little bit about this passion that you have for patients with pain and this phrase, leading patients out of pain.
Yeah, well, we as believers, Jesus is our model for healing, and everyone that came to Him was healed. And so we carry that mindset, right, when we walk into our practice. When I look at people with these chronic pain conditions, there's often hope that's been lost that needs to be restored. And my mindset is that Jesus wants to heal them. Heaven has a solution for them. And so I want to look at whatever it is that needs to be addressed in order to see them experience freedom from these painful, debilitating conditions.
And you see your part in this as being a part of the bigger thing that actually God is doing, and that He can use all different aspects of your skill sets and your spiritual connection with Him to heal patients. Is it all about the natural? Is it all about the supernatural? Did that take you a while to figure out?
Yeah, I would say I've gone on both extremes, in this discovery, in this journey to try to find how to address all the different dimensions. I know when I first started, I thought the spiritual was the only way to do it. I put priority on it, and I thought praying for my patients was all I wanted to do.
Wow.
But then I learned that excellence of care, my skill sets are important too. And so then I kind of got away, I would say, from the spiritual part and focus only on my skill sets in the natural. And it's interesting because what I learned was spiritual, praying for patients or doing effective techniques as a physical therapist, we can see amazing results, but yet forget to check in with the Holy Spirit. And so what the Lord's been teaching me is how do I integrate all these tools, but hold them lightly and waiting on what does the Holy Spirit want me to do for each patient individually.
So from your experience, do you actually find that the Holy Spirit might prompt you to do natural or physical realm things to bring about a patient's recovery? I mean, is it possible that actually a supernatural source for healing directs a natural therapy?
He does. He does. And I'm going to be honest. I wasn't always completely convinced of that at first. But as I began to communicate and listen to the Holy Spirit, He began to impress upon me different natural techniques to help patients that would lead to, I would say, supernatural results.
And these are like your classical physical therapy training skill sets, right? Like these are standard of care in your specialty, and the Holy Spirit will actually prompt you to use your skills sometimes. Is that right, what you're saying?
Yes. I remember I had a patient, and I was having a tough time getting breakthrough for her. She had a shoulder injury a rotator cuff tear, and there's two specific movements that were continually painful for her. We just weren't getting breakthrough, and so I was just out of a frustration and just wanting to get her better. I just said, Lord, what am I missing?
Mm.
Like, what am I missing? And I'll never forget, he highlighted this book with the techniques that I use to me. I remember I just saw it in a picture of it. And I thought, I thought I checked that already. I thought we addressed that, but maybe I'll check it again. And so I remember with this patient, I addressed a specific system in the body that I forgot to, or that I felt like I should check again. And sure enough, as I did the technique for her, those very directions that I've been having trouble with for the past 2 months, all of a sudden she is pain free in those motions.
Wow.
And so there was nothing about it that she knew I was asking the Lord. There was nothing where I asked to pray for her. I mean, to her, it was like,
Mm.
okay, yeah, you just did physical therapy, but it was this supernatural encounter that led to using techniques in the natural to see my
Uh,
patient get freedom.
wow. So, what has that led you to believe about this kind of creating a dichotomy between natural and supernatural? Is it real? Is it a real thing, or is there this beautiful synergy?
That's it. That's the word right there, Dr. Jen.
Mm.
Synergy. I think there's a beautiful synergy that the Lord is doing with kingdom-minded healthcare providers. That he is giving us these natural ways to see people get well, but we don't deny our ability to partner with Holy Spirit to see the Lord move supernaturally as well. And
Mm.
like you said earlier, as we partner and listen to what the Holy Spirit wants to do, He will let us know which one of those in the moment will be for that specific patient. It's not a protocol, it's dependency on
Mm.
His voice.
And you have come to believe too that in learning about and discovering the process of really helping people completely be whole and free from pain, that it can be multidimensional. And perhaps you can speak a little bit to that. When you say leading people out of pain, what does that encompass?
Yeah. As a physical therapist, I'm looking holistically, right, at someone's problem. If they have a knee problem, I want to look just not at the knee, but I want to look at the hip. I want to look at the foot. I want to look at the back, right? I want to look at them holistically that way. And I also want to look at them holistically in that it's not necessarily always just a muscle or a joint, but maybe it's the fascia. Maybe it's the different systems, the nerves, the blood vessels, things of that nature. But it might also be an emotional wound. It might be a past memory. It might be a spiritual affliction. Maybe there's unforgiveness. Maybe there's generational iniquities that tie in to this person's pain that maybe is blocking or slowing down the healing process.
Mm. And you've really been able to witness that on a practical level, seeing patients really affected in their body, carrying physical sensation and loss of function with a root source in an emotional area or in a spiritual area. Um, that is something that is becoming better described in our current literature. Like there's a growing awareness of this multidimensional experience that our patients have that we can't deny. And you have encountered that as a physical therapist and embraced it. How do you do that as a physical therapist? And how do you lead people out of their pain when it has multiple sources?
It depends. I would say it depends on the grace given in the moment,
Hmm.
and what the Holy Spirit's doing. But um, if there's grace to address those areas, oftentimes the Lord will, as a physical therapist, we sometimes utilize diaphragmatic breathing. We know that it activates our rest and digest system, the parasympathetic nervous system. And so if someone's having if someone had emotional wounds, for example, often what I'll do if there's a grace for it is I'll have them start to just close their eyes, begin to breathe diaphragmatically, and if they're open to it, I've had patients release forgiveness.
Mm.
I've had them release burden. And I remember I had one patient that had a tremendous financial burden, and they are coming in for lower back pain. And as I had them breathe diaphragmatically, I had them release all their stresses and their worries to Jesus. And as we prayed, she felt what she described as a whoosh come over her body and out of her body. And so that burden, that emotional wounding released from the body, and she began to experience healing in her back, but she also received healing from anxiety, and her doctor even took her off her medications for anxiety.
Wow. It doesn't sound like that took a lot of time. When you say you lead somebody to release, what does that mean? Does that mean you coach them on words to say? Does that mean that you ask them to agree with a prayer? Like, what does that actually look like?
Yeah, I I'm not one for protocols, so I it's different every time. And so with this patient in particular, I had her put her in her own words. I said, whatever burdens you're carrying, I want you to just you and the Lord, you and Jesus, just have this moment where you're just speaking to him and releasing that to him. And sometimes I'll give them words that I would use personally, and then they will often use their own words.
Mm.
But I would say it's different every time. But if I can connect them with Jesus, that's my main goal.
Mhm.
I as long as I can get them connecting with Him, I know that the Holy Spirit will work and begin to move on those emotional wounds.
Wow. I mean, I know that sometimes as clinicians, we feel a little bit uncertain about approaching deep emotional pain with our patients because we have this preconceived notion that it's going to take a lot of time. And certainly there is a really important role for well-trained, certified therapists to sit there with our patients as well and also participate in healing. And that can take time. But I think you're also alluding to this possibility that there is healing that can take place simply because you're able to connect someone to the person and the power of Jesus. And what would normally take a lot of time and work might not. And you, as a physical therapist, though you are not trained and licensed as a counseling therapist or a psychiatric therapist, you are certified to connect them with Jesus. Is that what you're saying? This is possible? Hey, Healthcare Tribe, I hope that you have been impacted by what I've brought through this podcast. I also want you to know about opportunities to give back through my nonprofit, Selah Health International. We work to support projects for women and children of vulnerable populations around the world. You can learn more and donate on our website, selahhealthinternational.org.
This is possible. This is absolutely possible. And I believe the Holy Spirit, of course, He could do things in a moment. Of course, He could do it in a moment. And I would never try to deny the importance of, there are wounds that will take time, and that's absolutely that's why we want to work as a team. That's why I believe in collaboration. Mm-hmm. I believe in the different disciplines, and I honor therapists that will walk through people through deep emotional wounds. But if the Holy Spirit is showing me that He wants to heal a certain area, I am trusting Him that He can do it in the small window of time that I have with those patients. And
Yeah.
it's one of those things as we step out and see God move, we begin to become more confident in His ability to do it in those moments.
Mm. Do you feel like it's important to cultivate and nurture a sense of the presence of God in your workplace? And how do you do that practically, especially if you're the only one who's a follower of Jesus in your workplace?
No, the presence of God is I would say vital to cultivating in practice. Especially the way our healthcare system is. We are a system that needs hope. We need the light of Jesus. We need the presence of God in our clinics, in our workplaces. And so the presence of God is something that I'm always working to cultivate, and I believe it's something where, as I become more intentional about it, it's something that I know He shows up. I I I often go to my treatment rooms beforehand, and I just take literally, I only have a couple minutes, and I just connect with the Holy Spirit, and I just ask Him to cover this room with His presence.
Mm.
And as I do that and connect with Him, I can sense His presence and feel His presence and actually sense the shift that happens. And so that's just the way I like to cultivate His presence. And I can't say enough about how much difference it makes when I'm able to do that.
Mm. And you really believe too and partner with this idea that He lives within you by the power of the Holy Spirit. And so the fact that you walk into a room equals His presence walking into the room. Have you ever felt that in a really profound way where you are so aware of His presence, even if there was not an opportunity to openly acknowledge that with the patients, but you're aware of Him being there with him, that His power was in your hands? Sometimes this is all just so natural for you, but sometimes it's really highlighted.
Yeah, there's been a few times where the presence of God was very tangible to where patients would actually experience it. And I would say they didn't know exactly what they were experiencing, but the statements that I would hear was, as soon as I walk into this clinic, I don't know what it is, but my pain completely goes away. Or when I walk into this clinic, I just feel so peaceful. And of course, we recognize that's the presence of Jesus, but it's amazing to me that maybe those that may not know the Lord are feeling the real deal, and may not even know what it is they're experiencing. But that's His presence to me.
That's for you kind of the feedback of the evidence of, yeah, He's here. Yeah. How have you incorporated some practical things in tridimensional healing as a PT? And I'm thinking, like, do you have any rhythms that you've incorporated where you ask patients particular questions, or do you really wait for them to tell you and you're looking for the signals? Like, what's your rhythm?
Yeah, my rhythm of late, and it changes with each season we're in, but I think my rhythm of late is to do what I call two-way listening. And so I like to listen to my patient, because often my patient will have the answer if we continue to talk and get to the root of the issue. And so there's been many times where patients will give us the answers, and I see it in doctors' notes. Oftentimes they're giving us the answers, and so I think if we look at that, we can often find the root. I can't tell you how many times I've seen in these notes where it's like, patient describes weird energy over them that every time it happens, it causes pain. Or, patient having nightmares about snakes attacking them, or different things where that's the key, right? Like that's the patient giving us these answers, these keys to how do I get free. And so I believe listening to them is very, very important, but listening to the Holy Spirit too. And
Ooh.
so that's why I call it two-way listening. It's listening to Holy Spirit. What's really going on,
Mm.
Holy Spirit? And then patient relationship connection with them to hear their story and how they need freedom or healing in that specific area.
Mm. So you mentioned having terrifying nightmares as being sometimes a signal, like there's something going on here emotionally or spiritually, and the person is giving us that clue. They are receiving this clue from their own body. How do you approach that? And I know you're going to say it's a case by case basis, but do you offer help to somebody experiencing night terrors if you feel it has a spiritual component? And what might that look like?
Yeah, I could think of specifically with the nightmares, but in general with I would say something like a inner healing need or deliverance need. Um, I do usually a couple of things. The God moves powerfully through intercession, so sometimes I can be working on my patient,
Yeah.
doing my hands-on care, and I'm praying in tongues. I'm commanding any spirits to leave, any oppression to leave, and I've seen powerful effect from that. But also, I address the nightmares. I say, because sleep is important when it comes to pain, and so I say, I know sleep's important to you, and it's important um, for your healing and restoration. Um, have you done anything? What do you think about those nightmares? Or if they're having fear, we address the fear. As a physical therapist, I'm trained to address the fear of movement. Often patients will have the fear of movement, so we address fear, but it's usually through exercises, education. But if they're having fears that are maybe more spiritual in nature, if they're open to it, I'll ask if we can maybe pray into that a little bit. And as I pray for the fear to leave, I've seen the Lord free patients from spirits of fear, because we know that there could be a spiritual component to those fears as well.
Yeah, I think this is an area that biomedical medicine has not understood and embraced yet, which is that there is spiritual influences on disease and human experience. And we know, because we are followers and lovers of Jesus, that he is the ultimate authority over every other spiritual power because of the work that he did in restoring us into relationship with God the Father. And because he is the great authority, if he's within us, we actually have the capacity to carry that same authority and, as you say, release it. And it's so easy. And you believe that within you is authority that's greater than whatever spiritual power is affecting or influencing the patient in front of you. And that it's not actually that difficult because he is the authority. And I think that you're describing this beautiful interaction with a patient as deliverance, because that's what it is. It's simply eliciting, hey, do you think this is part of what's going on for you? Is this really bothering you? Would you like this to end? And that the person in front of you agreeing they would like this to end is the invitation to the authority of Jesus to come and be present. And it doesn't even take this big, awkward deliverance moment. It's simply in your own authority with your own words saying, I agree. And I just believe that these night terrors can end and they can go now. They can leave you and never come back. And that's enough of that. And those declarations, they don't sound particularly churchy or Christian, but they are imbued with the power and the authority of Jesus within you. And you are doing that every day. So when you say somebody has a spiritual component of their pain and they need deliverance, you're not necessarily referring to some big, dramatic, charismatic deliverance happening in your treatment room, are you, Joey?
No, and the Lord's grace has been there for that. I can remember I just had a patient actually where she had been coming for a brachial plexus injury, fractured her humerus, frozen shoulder, and we had made great breakthrough with the natural, but there's still something that was like stuck, that was just not allowing her to get that full freedom. And the Holy Spirit brought to mind a past memory of trauma that actually it was stuck in her brachial plexus. I saw it just as a picture, and there was a spirit of trauma and a spirit of fear that was, I think, blocking her healing. And so we just simply, she was totally open for prayer. She wanted breakthrough. She was all for it. And so we just said a simple little prayer to command those things out. And she felt immediately this heat come over her shoulder. And she emailed me the next week saying, my pain is gone. My
Come on.
emotion's better. 3 weeks after that, her neurologist cleared her from any type of necessary surgery or any further intervention. He said, you're all good to go. And so it was the spiritual component that led to the complete breakthrough. And like you said, it doesn't have to be a long moment. Sometimes it could just happen immediately like that.
That's so beautiful. I mean, what if, Joey, what if more people like you, like me, who get just a little bit braver and get willing to consider and believe that Jesus wants to be present with them in their everyday work, actually begin to embrace some of these other components of multidimensional care. And we start to see people actually really completely getting whole, not just a little better, but all the way whole, right? Isn't that your heart? Like, I want it the whole 100% way, because that's the Jesus I know.
Absolutely. I believe, Dr. Jen, that God is putting on hearts of all believers in healthcare for this type of whole person healing. I see it all over this country and globally, and I'm so excited for what he's doing globally. I believe this is his heart, to see people set free and to receive deeper and deeper healing. And he's put this on us as believers to be lights in the darkness. And like Exodus 33 says, the presence of God will distinguish us from other healthcare providers. It is God's presence that is going to distinguish the healings that we see, the breakthroughs that we see in the medical world.
I wonder if you feel any particular encouragement that you'd like to give for your fellow physical therapists. I mean, I think what you demonstrate and live is so inspiring. What would you say to your colleagues about stepping into this and the purpose and the power that they could live in?
I would say, as physical therapists, I believe we are equipped and set up to be able to address the whole person. What I love about our field is that we get to walk with people through the process. We get to be in the person's journey at oftentimes their most painful, most difficult moments, and we get to be there, develop relationship. We get to release the compassion of Jesus, and we get to look at people not only just in their injury, but you develop a relationship, and they're often pouring out their emotions. It's just something that naturally happens as you work with someone for months. And so for the physical therapist, I would say that there's a grace, there is a lot of opportunity for the Holy Spirit to move in powerful ways, both naturally and supernaturally. And I would say our natural skills as physical therapists are not less than.
Yes.
They are amazing and they are God-given. But he also wants to move supernaturally. And if we listen to the Holy Spirit, where our grace is in our specific fields, I believe if we take that, if we just give that opportunity for Holy Spirit to move, he'll show up and help us to grow in being able to see him move more and more powerfully from a whole person perspective.
Beautiful. Whole person care, whole person relief. Joey Park here with me today with a fantastic charge to all of you physical therapists out there. You are chosen. You are anointed. You are a wonder-working example of the heart of God to this world. Thanks for being with me today, Joey.
Thank you so much again, Dr. Jen. Thank you for what you're doing. And it is so great to have been here.
And thank you to all of you listeners who have been following what we're doing here. It's been a fantastic time. I'm Dr. Jennifer Kang, and this is the Restore Healthcare Project. Healthcare professionals, I'm so excited to be able to connect with you on issues regarding spiritual needs in healthcare. We want to partner together to see some of the ruined places of healthcare culture restored by hope. Follow us at restorehealthcareproject.org and like and subscribe to our YouTube channel and social media.